Duloxetine. Now before we start, let me give you a quiz. What is a better question to ask yourself? 1. Why am I always depressed? 2. How can I be happy? Leave the answer down below in the comment section. Hi, it's pharmacist Sunki here. If you are being prescribed Duloxetine, do not be afraid to take it, because you and your doctor would have weighed out that the benefit of taking it exceeds the risk of not taking it. Remember, if you are experiencing depression or anxiety, you are not alone. Many people experience depression and anxiety in life, and you do not have to be in this mental state. Just like blood pressure and diabetes, they are conditions that can be treated. Speak to your doctor today about it. Many of my patients have successfully turned their life around for the better and feel happy again. Duloxetine Common brand name Cymbalta is a SNRI, Serotonin and Noradrenaline Reuptake inhibitor used to treat depression, anxiety, nerve pain caused by diabetes, fibromyalgia, chronic musculoskeletal pain, and stress urinary incontinence in women. If you are interested in knowing more about how it works in your brain, I've made a video about Sertraline, which is also a SSRI, which works similar to SNRI. This is an animation video. I will put the link down below for you. Duloxetine is strictly a doctor's prescription medication. Do not self-prescribe. This is not an advertisement. These information are for general nature only. It does not replace the need for you to get advice from your local doctor and pharmacist. Before you start taking Duloxetine, tell your doctor if you have any allergies, if you have had any medical conditions. This includes glaucoma, high blood pressure, heart problems, kidney problems, history of seizures, bipolar disorder, diabetes. If you drink alcohol, tell your doctor how much you drink. Drinking too much alcohol could increase the chances of you having liver problems during the treatment. So Duloxetine may not be appropriate for you. Tell your doctor if you are pregnant, plan to become pregnant, breastfeeding, or plan to breastfeed. If you are going to have surgery, tell your surgeon and anesthetist you are taking this medication. Do not take fluoxetine if you are taking another medicine for depression called monoamine oxidase inhibitor, MAOI, or have been taking a MAOI within the last 14 days. Usually, if you are swapping from a different class of antidepressant, there is a washout period. Washout period means that you need to wait for the previous antidepressant to clear out from your body before starting a new antidepressant. Every antidepressant has different washout period. Your doctor will instruct you what the washout period is. Drug interaction. Duloxetine can interact with many other medicines such as St. John's wort, a herbal remedy that is used to treat depression. So let your doctor know all the medication that you are on. This includes anything that you buy without a script from the supermarket. Now hang in there. There are more important information coming. If you have gotten value out of this video, please hit the like button down below, consider subscribing, and turn on your notification button. How do you take Duloxetine? Depending on your condition, the doctor will prescribe the appropriate dose for you and adjust dose along the way. Take Duloxetine at the same time every day with a glass of water. It doesn't matter if you take it with or without food. If you have trouble remembering to take it, set an alarm at the same time every day to remind yourself. Do not open the capsules and crush the pellets inside, because that may affect the efficacy of the medicine. Duloxetine takes 2 to 4 weeks to work, and for nerve pain, it may take longer. Before the beneficial effects kick in, you may experience some minor side effects, such as dry mouth, tiredness, difficulty sleeping. These side effects should go away within 1 or 2 weeks. Tell your doctor if the side effects is severe and does not go away. If it's minor side effects, just push through it and be patient. Keep taking the medication until the beneficial effect comes in. If you do not start to feel better in about 4 weeks, check with your doctor. Now, once you're stable on duloxetine, do not stop abruptly. Discuss with the doctor when you are ready. The doctor will come up with a plan to slowly wean you off the medication. If you stop abruptly, you may experience withdrawal effects like nightmares and zapping sensation. Side effects. Duloxetine is generally well tolerated and most people do not experience the side effects. Occasionally, symptoms may get worse during the first 1 or 2 months of treatment until the full antidepressant effect of the medicine kicks in. This is more likely to occur in young adults under 25 years of age. If you have someone around you, let them know that you are on duloxetine and ask them to keep an eye on you. So if you experience worsening of the condition, becoming more depressed, more aggressive, angry, wanting to self-harm, or having suicidal thoughts, you, your family, or carer needs to call the doctor or see the doctor immediately. If the doctor is not available, go to the emergency department of the hospital. It is crucial for you and your doctor at this point to work closely to achieve beneficial results. Also, contact your doctor immediately if you experience any of the following. If you feel sleepy, you feel nausea and vomiting, have tremors, uncontrollable movements, you feel dizzy, have a seizure, or you tip the other way around where you feel euphoric, where you have excessive enthusiasm or excitement, or you feel restless. You have constant headaches, long-lasting confusion or weakness, or frequent muscle cramps. These can be signs of low sodium levels in your blood, which can cause seizures in severe cases. Dizziness or fainting when you stand up, especially from a lying or sitting position. Yellowing of the skins or white of your eyes. These can be signs of liver problems. Eye pain or blurred vision, vomiting blood or dark vomit, coughing up blood, blood in your pee, black or red poo. These can be signs of bleeding from the gut. Bleeding from the gums or bruises that appear without reason or get bigger. If you experience serotonin syndrome, these symptoms include feeling confused, restless, heavy sweating, shaking, shivering, hallucination, muscle rigidity, sudden jerks in your muscles, diarrhea, or a fast heartbeat. If you have an anaphylactic allergic reaction where you experience itching of the skin, rashes, hives, shortness of breath, wheezing, trouble breathing, swelling of the face, lips, tongue, or other parts of your body, send yourself immediately to the emergency department of the hospital. While you're on duloxetine, make sure you keep all your doctor's appointments. The doctor would need to monitor your blood pressure, heart rhythm changes, your thyroid, and liver function. One very important thing to take note: antidepressants act as a crutch to help you overcome things a little easier. While you're on antidepressants, it's crucial that you apply self-help. Listen to motivational speakers on topics of depression, how to treat yourself better, how to better your life. Talk to your doctor about psychotherapy, go for counseling session, and do meditations. Work towards changing your thinking pattern, changing the way you communicate with yourself. So when you're off it, you are able to stand on your own. Now, if you haven't already answered my question, comment down below what is a better question to ask yourself. 1. Why am I always depressed? 2. How can I be happy? Remember, the quality of the question you ask yourself is going to determine the quality of your mental health. Let me know also in the comments below if making a series of videos and helping changing your mindset would help. I hope this is of value to you. If it is, please give me a thumbs up, subscribe, and turn on the notification button. It's your pharmacist Sunki here. See you around.